Good evening, and welcome to another edition of African Americans Ain't Africans, the thing show that proves without a shadow of a doubt that the so called African American didn't find his way to America in the trunk of a ship. I'm your host, the Indigenous One, and this week we're back with the introduction to mental health in our communities. And we've been gone a couple of weeks because there's been a few things that we had to do. So we're back with the mental health version episode of this talk. So without any further delay, Nicole, you have the floor.
Thank you. How's everybody doing? How are you doing, Carrie?
I'm doing great.
That's good. That's good. Okay, so the last show we left off on signs and symptoms of developmental delay. Um, I just want to let you guys know as I'm going through this, I'm still adding things to it. So there's probably going to be questions, but I plan on covering that. I'm going to go into nutrition and how it affects our mental health as well as our society, our environment. I'm going to break it all down as much as I can. And if anybody has any feedback that's on a positive level or negative, let me know. But with further ado, let's jump in. And this screen or this section, we're going to talk about the signs and symptoms of developmental delay. Sorry about that. I'm talking too fast. There are many different signs and symptoms of delay that can exist in children and often vary depending upon specific characteristics. Sometimes you may see signs in infancy, other times you may not see it till the child gets into school age. Most common, the symptoms are learning and developing slower than other children the same age. When they're infants, rolling over, sitting, crawling, or walking much later and than you're supposed to be. But that one, I feel, it really depends on the child and when the child is ready to do those things. Difficulty communicating or socializing with others, lower than average IQ test, but the IQ tests really aren't based upon the way that we learn. So I'm kind of questionable on that one too. There's also difficulties in speaking and talking kind of later on, not right away like they assume average children would. Having problems remembering things, inability to connect actions with consequences, difficulty with problem solving or logical thinking, and trouble learning in school, or an inability to do everyday tasks like getting dressed and using the restroom without help.
Okay, question.
Mm-hmm.
Now, all of these symptoms that you just named,
Mm-hmm.
I see 50, 60-year-old people with the exact same thing.
Mm-hmm.
They have trouble communicating.
Mm-hmm.
They can't communicate. They'll tell you something. When you ask them to explain what they're talking about, they can't. They definitely have trouble getting dressed because they can't even pull their damn pants up or pull up a belt, put on a belt.
Mm-hmm.
Inability to correct actions with consequences. I mean, these don't sound like these are for children. These sound like these are grown people.
True, it does. I mean, the way society has been structured is that this can apply to adults as well as children. I think basically that a lot of these symptoms or characteristics start off as children, and that comes from your environment, where how you were raised, what goes on in your household. Once again, the foods that you eat, and if it's not addressed properly, which it's really not addressed properly in our educational system because we're relying on other people to educate our children. These children grow up to be adults who still have these characteristics. So I think a lot of this has to do with environment and also has to do with what goes on in the home as well, along with nutrition and society in general.
So these symptoms, they're just not. You see the noise in the background.
Mm-hmm.
Uh,
That's not coming from you. There's nothing in here.
oh, okay.
Okay.
All right. But all of these symptoms, this is what I'm saying. I'm seeing these in fully developed people who are so-called men and women.
Mm-hmm.
So what you're saying is we're raised or we're taught to have these disorders because that's what it seems like.
It does. I mean, I think a lot of it has to do with the fact is that so many people or so many children have gone without it being addressed, and it just have been continued, you know, it has continued on. So like say my mom has ADHD, for example, right?
Mhm.
And she doesn't know she has it, but she has me and she raises me. I'm going to follow characteristics that my mom has. So I think that generationally some of these behaviors are passed down. And so I, you know, and they, you know, it's been called developmental delay, but I really think from the way I'm looking at it, and I could be wrong, that it's a passed down more so of a behavior. Also, you know, with not being able to talk and things like that, if this people that you are around aren't speaking the vernacular of correct English, as they call it. You know, they're combining their tones and their words and mispronunciation and so forth because this really isn't your language. Then it's classified as having a speech impediment when actually it's because your body, your spirit knows that that's not the language you're supposed to be speaking. It's what was forced upon us. So, I mean, there's a fine line in between all of these things, in my opinion, because of the fact of how many people don't know how to read, how many people don't really socialize with others, how many people might have a low IQ test because they are intelligent in other ways, but not in the monolithic learning system that is in the United States.
Okay, I was just wondering because you were saying this, and I see this in fully developed
Mhm.
adults. I
Yeah.
mean, they'll make a statement, and if you don't understand it, you'll ask them to just as simply explain. What the fuck you
Hmm.
mean explain? You know, they start going off.
Hmm.
So I'm wondering, is that part of the this developmental disorder?
Yeah, it's a communication disorder. Because if you ask someone a question and they can't explain it, they could just say simply, "I can't explain it. This is just my opinion," instead of getting offended and kind of letting that anger and stuff take over. And it seems like we have a lot of very angry people who really don't know how to communicate, and that could be because the fact is that we have that ideology of don't talk when don't talk back and all that stuff, don't speak your mind, shut up, sit down, and so forth. So you're kind of in that aspect, you're stifling the development of that person by not letting them speak. And also if you're not eating properly or things that you're having, not, your brain development isn't good. So I think a lot of these characteristics are within our community because of those reasons, and they have not been addressed unless they're going to school and it happens to be in the school system where they're like, well, we can get money by if we get an IEP on this child because this child's having this problem in class because they're not behaving like the other kids who are just sitting there doing their work or whatever. And so if that child grows up and none of these issues are ever addressed, we run into that problem where they're not able to vocalize their thoughts properly, and then they get angry and they have some type of violent or discombobulated behavior.
So how often does that happen?
It happens a lot. I mean, because I have my son, is incarcerated right now. And when he was in school, from the time he was like second grade, they diagnosed him as having ADHD, which I plan on talking about later, along with the learning styles and kind of putting it all together. But when you're labeling the child as having special needs, but you're not giving the child any assistance with that special need, you run into the problem where you have all these consequential reactions or effects from it. And so then that child grows up and still doesn't have the reasoning ability to be able to say this is wrong, I shouldn't do this, or this is right, or whatever. So it all, it's a combination of home life, it's a combination of academic life, it's a combination of society. I mean, we, conjunctively, we put a lot of pressure on our children. So when they just walk away with a learning disability, I think that that's a blessing in a way because of the things they could walk away with.
Right. Okay.
So the next one, where were we? Hold on. Okay, we're on communication disorder. I'm like, wait a minute. Okay, so the next one, would go in with what you just said, Carrie. It's a communication disorder, and basically it's a disorder that affects the individual's ability to comprehend, detect, or apply language and speech to engage in discourse effectively with others. The delay and disorder can range from simple sound substitutions to inability to understand or use one's native language. Well, I guess we all have communication disorder then, because we are not using our native language. And I think that our physical, our spiritual, and our soul, we knows that. And so I honestly, I believe that's why the misuse of English comes about, because it's not our native tongue. The types of communication disorders are language disorder, speech sound disorder, childhood onset fluency disorder, which is stuttering, social communication disorder, which could apply to what you said when you ask a person a question and you respond angrily, and unspecified communication disorders, which I don't understand how you can have a category for that, but I did put it in here because it was in my research or my studying that I did. And then what causes communication disorders are abnormal brain development, exposure to substance abuse or toxins before birth, cleft lip or palate, which really doesn't run in our community. It tends to run more so like in third world countries because of deficiencies in certain supplements that the pregnant mother needs. Genetic factors, traumatic brain injuries, neurological disorders, strokes, tumors in the area used for communication, which is the brain tumor, brain cancer, things like that.
Okay, so when you say neurological disorders, what exactly do you mean?
Your poor brain development. If you are epileptic, if you have seizures, and meningitis affects the brain, things like that, that can cause you not to be able to have proper brain function.
Okay.
So then the next one is autism spectrum disorder, and that's basically a disorder involving a range of psychological conditions, all characterized by abnormal social interaction and communication, restricted interests, highly repetitive behaviors, and eccentricity. Now, I have heard, and I do feel that it is true, that autism comes from vaccination. It seems like a lot of children who and empathy were developing just fine normally as they go to the doctor, doing the sitting up, all the normal stuff. Then they get certain vaccinations, and now they have autism. Um, Autistic children like tend to be really brilliant though. They tend, like if you guys ever saw Rain Man, that was an autistic man. So autism is just kind of one of those things that you have to look at, because they're saying that it started at this time and it started with that time. But we have found out, or not we, but people who have studied it have found out that the Negro children are affected with this about 44%. It's really not a high level as it is in some other communities, but it does exist, and sometimes people go undetected for having autism. It has a lot to do with what they claim, and I don't understand how it could, but household income, the IQ level of blood relatives, preterm births that are linked to cognitive outcomes, which means early births, the weight of the child being affected, the ethical imperative, and leveling playing field for the timing of diagnosis, which means that they go undiagnosed, while in school it kind of gets skipped over. So those are some of the things with autism. And also, once again, I believe like the ingredients that are in the vaccinations are causing a chemical imbalance and affecting the development of our children when it comes to autism.
So with these upcoming vaccinations, I mean, I don't think a lot of so-called Black people are going for it. But is that a way to spread the autism spectrum disorder? Because you said it's in vaccinations. Could that be spread through the vaccinations?
I believe so, because like if you with the test results or the clinical trials of the Moderna shot that's going on, there have been deaths, there has been stroke-like symptoms, they're affecting you with, they're giving you, the virus supposedly and your body is supposed to fight it off, and it doesn't seem like it's really doing what it's supposed to. This scenario kind of reminds me of the movie Venom, when they were taking the symbiote and putting it in people, and the people were reacting all weird and all that. This is kind of seems like that in a way. But either way, if you give this vaccination to a pregnant mother, I would say autism could possibly be a result of it. I'm not a scientist. I'm not a doctor. I'm not a virologist. But from the clinical trials that I read, it's not something that I think pregnant women should take. I don't think, nor should babies. It's really there's little known about it. They claim it was described early in the 1940s, but once again, it's a little known about it. They kind of give you a minute amount of information about autism. They have the Autistic Society and stuff like that, but they don't want to put it off on vaccinations because they don't want another Tuskegee experiment. And I kind of believe this falls along that.
Well, because I'm just asking because I kind of try to, pay attention to what's going on. And ever since this autism has been out, everybody, especially the ones who've taken the vaccinations, they swear it's the, vaccines.
Yeah. And they would know.
Yes, and they would know.
I mean, they definitely would know because it's affecting their children. So of course, they would definitely know. And it with autism, it's like if you have your baby. I mean, your child. If you're with your child, crawling, eating, talking, laughing, and then you take your baby to get the required vaccinations, and all of a sudden your baby is lethargic or not moving or not showing normal development stages like we would think. The difference in your child, and what caused it. And people want to put it off on household income or IQ level of blood relatives and all that stuff like that. Those are excuses to me to get out of owning up to what is going on, because they haven't properly tested those vaccinations before giving them to the public like they're doing now. And they also don't really care about the medicine or the medical care that is given in our communities, and we're not adhering in developing those things ourselves. So we're kind of putting ourselves as a victim in the situation without really adhering to the fact that that's exactly what we're doing.
Okay, so check this out. So this is what I want to know, because in 50 years it'll be something else. What if the parents of a kid who has autism, what if they picked up some of these developments when they were children and they autistic themselves, but have never been diagnosed as that?
Then it's going to pass on because it hasn't been diagnosed. So that could be, that could probably be a case too, because you have a lot of people walking around here who are the children of people who have been experimented on. And they've just learned to survive and live with whatever is going on with them, which tends to be the case with a lot of us, because we don't get the same treatment when it comes to adhering mental issues. We don't address it properly within our community. We don't, and it doesn't get addressed in the society because we are told we're just supposed to deal with it. From so-called slavery times to now, we're looked at as, we can take pain, you can take that, don't worry about it, just keep on doing this, keep on doing that. Oh, shut up. So a lot of the things that are going on in our communities now with these disorders and the medical care and stuff like that, is kind of because we haven't taken the initiative to put in the effort to have these things researched for our own people, nor have we reached out to find out how to diagnose people of these things either. We've kind of looked at it and kind of brushed it under the rug until it gets brought to our attention.
How much does the environment play into it?
I'm sure the environment plays in a lot, because I think autism has to do with metals being put into your body. So if you go outside and you look up and you see the chemtrails, which everybody, has their conspiracy about, if you're breathing in aluminum and barium and all these other things, then you're drinking water that has fluoride in it, then you're eating food that has metals and plastic in it, like Cheetos and stuff like that. And you're not, and then you have a pregnant mom who's eating Cheetos, breathing the air, drinking soda, and all these things like that. What do you think is going to be the end result? You're going to have a child who has poor brain development, and the possibility of being born with autism is also there as well, because they also put metal in things in prenatal vitamins that they give you over the counter.
So check this out. So one of the things I do, we have an older cat around here. He fixes computers, right?
Mm-hmm.
And every couple of weeks I'll get a computer for him and donate it to one of the kids in a community. They may be autistic, they might have some learning disability.
Mm-hmm.
But when I'm talking to them, they fucking more intelligent than the average dude.
Mm-hmm.
I mean, so, my thing is, well, why are you called this? Or why are you being called this? And, and they'll just flippantly say, I don't know. That's what they say. But they're they are, I mean, seriously, they're more intelligent than cats called PhDs.
Yeah, yep. And that's something I'm going to address. I'm sorry, Carrie, but that is something that I'm going to address a little bit later on, because we don't learn the same as everybody else. We just don't. We don't learn in the same monolithic fashion. And that's not addressed. We're supposed to adhere to becoming good citizens in school and learning from that monolithic fashion, and we don't. And it needs to be brought to the attention of not only our communities, but if we're going to rely on other educational systems, it needs to be brought to their attention too, because them expecting for us to learn in this fashion where we just go to class and you sit down and you take notes and you just listen, it doesn't work for everybody. And it doesn't work for our children, because our children are active. Our children like to move and play and dance. And I have seen classes where they incorporated all these different movements and dancing and playing and recess, like they don't have recess anymore. So they incorporated all these things into teaching the children, and the children had a high success rate.
Well, so what I'm noticing with these kids
Mm-hmm.
they on a whole nother level. They are not playing. They ain't playing. They on a whole nother level, baby. All right, so go ahead.
So the next one is ADHD. Now, ADHD is supposedly a chronic condition including attention difficulty, hyperactivity, and impulsiveness. ADHD often begins in childhood and can persist into adulthood. It can contribute to low self-esteem, troubled relationships, and difficulty at school or work. Symptoms include limited attention and hyperactivity. Treatment includes medication and talk therapy. So, ADHD is got two sides of the fence. They're saying it's real, they're saying it's not real. Once again, I think ADHD is a falsity because of the fact that we don't learn the same. We do not learn the same way as everyone else. Our children are musical. They like music. They like to dance. They like to play. They like to run. They like to be outside. They like to come inside. You have to create a learning curriculum that adheres to our children. And that has not been done. So when you're a child who is active and needs to rip and run because you got energy and you're just, you want to do all type of things, and you sit down in your desk, don't move. You're going to get bored. And then when you get bored, you start picking on stuff, picking on other kids, doing other stuff, grabbing, talking, and stuff like that. And you can't expect a child to sit like that and learn that way. And that's why we have such a high rate, according to other statistics, of childhood dropouts of high school and this and the other, because the kids are fucking bored. It is what it is. They're bored. I mean, when you come from a culture that gardens, that fishes, that plays outside, that builds outside, and that's what we did before we were colonized, and that's still within us, You can't expect your children to just sit down when that's within your soul. So ADHD, to me, and is kind of an excuse for them to use to give your children more drugs, and also to label your kids. And it's something that I learned after my son went to prison. I really started doing a lot of research into it. And honestly, I should have did it before. And I didn't, but now that I know more about it, I'm utilizing it in his case. But I really believe it's not something that is truly real because of the fact that we learn differently.
Yeah. So this is what David Corey is saying, and this is what a program we're going to do on things we never talk about. It's like you said, 12 months a year. Shut your damn mouth. That's how the kids are taught.
Yeah.
Don't say nothing. Don't express themselves.
Right.
But I got a little nephew that's well, I tell him, me and him agree that nothing's the fuck wrong with him, because nothing is wrong with them. It's what we teach them. And if we teach them that something's wrong with them, then they're going to play into it. And I don't understand how this kid gets it, and he's 8, and full grown adults don't get it.
To me, it seems like, remember that video that we put on a show a while ago of the lady who was talking about, please come get my kids, I can't take it anymore.
Yes.
Yeah, we don't want to deal with our kids. We don't want to deal with the kids. Sometimes I would be outside in the summer with my kids till 2 a.m. playing football and ripping and running with them. I mean, you have to get active with your kids. They're just not beings that you go, oh, okay, well, you know what, here, I had you, now find something to do. And sometimes we do that as parents, and so we don't adhere to these things. So when they go to the schools, they see that your child is an active kid, and instead of creating a system that would work for your children, which would be too much like right, they create one that doesn't work. And then you get the IEP, and they get money for that, and that money goes towards the programs that they want to have while your child is labeled. And ADHD and the school to prison pipeline all tie in together. It all ties together.
What did you just say?
The ADHD and the school to prison pipeline tie in together.
Well, how?
Because they created something that basically says that you're dumb. You can't learn. There's something wrong with you. There's something wrong with you. There's something wrong with you. And then they put those kids who are hyperactive. I mean, that's basically what it is. They have a lot of energy. Look at the diet. What do kids eat? Junk, candy, soda, processed foods. So it's all going into your bloodstream. You're all so you don't have. They cut off recess. They cut off a lot of the activities that they used to have in school, like wood shop, art. Some of the sports aren't even being played anymore unless you go to a school that's in the suburbs. So all these programs that kids had to exert that energy isn't there. So you're in class, you're high strung because you have a diet. The food they feed you sucks. So you're in class, you got this poor diet, you're hyper. You might not have a good home. You might have a good home, but you still might be overactive, and that happens. And that's called, in an adult world, that's called anxiety. But in the kid world, it's called ADHD. Either way, so you're in school and you're hyperactive. You're around kids. Kids are hyper. You're not being directed. Your energy is not being utilized. You got police in school. Kids are going to argue like adults that set examples for them. Kids argue, kids fight, kids follow their adults. They follow shows like Power and all that stuff like that, especially if they don't have role models that are teaching them to do or behave or socialize or how to communicate, which is something that we really don't address a lot. So they're in school. They got the police in school. What happens? Instead of having the conflict resolved and having it mediated like they do in Caucasian schools or schools that are in suburbs, they have mediation groups and they teach kids how to communicate and all that stuff like that. It's not happening in the schools that are in our communities. So you have all this going on. You got the police there, and what happens? The police expel your kid. Now your kid's mad. You might not have a good thing to go home to. Might be afraid of going home again. Their ass beat, which whooping is something that we held on to from slavery for some reason. And so you go home, you have that. So now the child's angry. What do you think the child's going to do? Go do something stupid. First offense, second offense, third offense. My son was 17. They tried him as an adult. So this has happened not only to my son, but other people's sons. And so basically they create a mini pre-prison for our children. And we sit back and go, oh, how are you doing in school? You getting A's? We're not asking, how are your teachers treating you? What's going on? Are we going to PTA meetings? Are we going to well, we can't now because all that stuff is closed. But when it was open, are you active in your kid's life? And I'm going to be honest, I wasn't as active as I could have been because I was a single parent and I worked 2 jobs. I tried, but I wasn't as active as I should have been. The jobs weren't as important as the stability of my children. And yeah.
I don't know about that. And let me tell you why. The schools are fucked up.
Yes, they are.
And for us to keep acting like we getting some out of it, that shit's embarrassing.
It is.
It is. Your kids are taught to be fucking idiots.
Yes, they are.
And you're acting like, oh boy, they're in school. And it's a joke. You know what this little kid told me one time?
What?
So with little kids, you know, and explaining the world to them, you got to give them in little chunks that they can chew and they can see. So if they're around 10 years old, you just use if they have a younger brother or sister.
Mm-hmm.
This cat asked me, he said, Mr. Davis, he said, when you were in elementary and junior high school, what did you do? And I'm saying this because you kind of brought it up.
Mm-hmm.
Oh, we had band class. We had all kind of stuff to do. You could get a job after school. I don't know if it was in high school or junior high school, we could work, but it was all kind of things that we can do. And so, you know, I was telling them, I said, could you imagine being in a band and you guys practice to some Ohio players? He didn't know who Ohio players was, so I got to show him who they were. Could you imagine being in a band practicing on some Stevie Wonder songs? You know, you're in a classroom full of people and you are learning these notes. You are learning these pieces of music. You are learning to put stuff together as a group. They snatched all that shit out.
Yeah.
And what these kids are going through now, we should be fucking ashamed of ourselves.
We, you know, and I'm guilty of this because I trusted the academic system to educate my kids because
it's not that you're guilty. That's not the point. The point I'm trying to get us to look at is what are we doing for ourselves?
Nothing.
Are we teaching our children to take over the world? Because the world is teaching them. The world is teaching their children to take over you. What are you teaching your children?
Well, you know, when the curriculum in the educational system starts you off from being a bottom feeder or a slave, it's teaching you to continue to be a bottom feeder or a slave. And when that is reinforced in the home through other ideologies that we'll also discuss that affect mental health in this, then what do you expect?
But I don't think it's that. I mean, how could it be that? Okay, here's an example. I went through elementary, junior high, and high school. When it was time for my kids to go, I was like, I wouldn't do that if I were you.
Yeah.
Of course, you know, we're trained to get into this social order, being married and stuff. The mother thought getting an education was wonderful. I disagreed. So years later, now that, you know, children are all grown up and stuff, so now they're seeing what I'm seeing because now they're in that position. And I ask them, would you give your children that shit that you learned? Would you turn around and give that shit to your children? And they say no. And that's what I'm trying to see. We have to see what's going on. We can't 50 and 60 years old, then finding out shit, and then don't have nothing to do with it. We ain't gonna be part of it.
Right. You're right.
You know, we supposed to be handing down shit to our children. Is this? I mean, seriously, this is what we're leaving.
Yeah, and unfortunately, if we don't make an immediate change, yeah, this is what we're leaving.
So that, you know, that's why I'm glad you're doing this with this mental health thing.
Mm-hmm.
Because it just lets people know everything that's around you, what you watch on TV, what you listen to the radio, your favorite comedian. Most 99%, they're there to fuck your mind up.
Yeah, I mean,
and I can show you.
Yep.
What we think is. Remember when comedians used to say, "We used to get our ass whooped." Remember you used to get our ass whooped. Those were cries out for help.
Mm-hmm. Yeah. I mean, and you go back and you look at it. There's a lot of cries out for help. It's in everything that I see done. I mean, the other day, just to throw this in there, the other day, this little girl came to my door and knocked on my door and said, do you have any garbage I could take out for $1?" This little girl plays outside in the little yard way they have right there. So I've seen her and, hi, and spoken to the little kids, but her coming to my door asking for $1 to take out some garbage was like, huh? And the fact of the matter is that in this day and age, your daughter is walking around by herself as a little girl, going to people's door, asking them, can I do this? Can I do that? What happened if somebody had to snatch that child? Because it happens. It happens. And the fact that her mom never said anything to her about it, I guess she didn't know or whatever. But I went outside and I saw her again. I asked her, I didn't know her name. So she told me what her name was. And I said, do me a favor. Don't go around knocking on people's doors, asking them to do tasks for them that you don't know, that are not in your environment. She was like, well, what do you mean? And I was like, what I mean is that people will snatch you and hurt you and take you away from your mom, and you'll never see her again. And I had to explain that this isn't my child, and but it is my child. So I told her, if you ever want $1 and you see me, ask me. I'd rather give you $1 and have you be safe and not than have to be helping find you and never finding you. Because that's what happened. Vegas is one of the largest areas of child trafficking. And I know that's off subject of this, but it all ties in together because we have to know what's going on in our children's lives. A lot of the things that are going on in society now, from this to bullying to abuse, are causing young children to commit suicide. And that's one of the reasons why I reached out to do this, is because of the things that went on with my son, and the fact that I want other people to know what's going on, so we can do, no, not maybe, we should, and we will be doing something about it, because this cannot continue.
So okay. All right, what you're saying, how do we recognize what you're saying? So I'm just an average student, I'm at home, I come and go. What signs would I look for to know this is happening?
It's all over. I mean, it's all over the media. I mean, even though the media does lie about a lot of things, it's prevalent in your community. I mean, you see signs of abuse and other things every day. You can't tell me you don't. You got people who are on meth and crack. You've got homelessness. You've got people being evicted. These are all signs of this. And then you also have, all you got to do, if you have a corner store in your area, is go there, and that's a source of all of them, a lot of mental illness, because it starts with nutrition.
Yeah. And a lot of people, they use them corner stores as a grocery store.
Yes. I mean, in the WIC program, WIC, it gives you baby formula. Baby formula is not good for your baby. It's not. You should be breastfeeding your children. I mean, you have to give your when you find out that you're pregnant, or you're whatever, you're pregnant, you should be looking at doing proper nutrition research. I mean, and it's not that hard because it's at your hand. If you have a smartphone, in your hand, you have a mini computer. You can find out whatever you're looking for. We need to be more proactive in the development of our children, the protection of our children, as well as ourselves and our community, and start recognizing the things that are being put into our communities, so that way we can stop these development of autism and ADHD and this and that, because they give us what they want us to have and we accept it. We don't develop what we need to support ourselves and sustain ourselves. And that's what we need to do.
That's what I'm talking about. I mean, damn. I mean, I what these kids are learning, because I have them in school. I'm like, you're kidding.
Yeah.
You're kidding.
Have you seen the new math? The new math is so confusing. They create these things that are just like, it's just 2 + 2. Now it's 2 + 1 + 1 + 2 and all this other stuff, and you got to do it sideways and upwards and side, and you're like, what? Why? It's simple. It's 2 + 2 = 4. You teach your child to use their fingers to count. You can use your fingers to count up to 1,000,000 if you really need to. But they cause so much, the education system causes so much confusion, and well, you can do this, but you can't do that. You got algebra, you got this, you got that. They don't explain it. Then you have teachers that don't like your children.
So we have a Freddie Finkel here. He said the real issue is that her dad should have a place. Yeah, and that's a real problem, because I know a lot of these cats who are out here on these streets are military cats.
Mm-hmm.
When you go and talk to them, talking about all these mental illnesses that you had, that PTSD.
I'm going to address that. Yep, I got that in here.
That's off the hook.
Yeah. And just throw in the PTSD just isn't a military disorder. It's a disorder that most of us have.
Yeah. Yeah, I mean, I be telling cats, I'm like, yo, dude, all you got to do, they're gonna give you a place. You was in the military. They you can say a lot of stuff about America, but America, there was a song a long time ago called "America Eats Its Young," and all of them are familiar with it. Maybe many more of us should get more familiar with it.
Yeah.
America does stuff, and they gotta compensate you. All these brothers on the street from ex-military, you tell them, yo, man, go down to the VA office. They'll give you something to get you an apartment, something to get you off the street, something to clean you off, something to, get you out of that rut you in. 99% of the brothers I know, man, I don't fuck that shit. I don't want that. I do my own thing. It's something that they're not accepting of it. To me, that's a mental illness.
Yeah, because they're looking at that as a handout and all of that, and it's not. It's what you're owed. You joined the military. You went to fight or whatever for a country that when you come back to it, you're treated like shit, and you're owed that. There's so many loopholes that veterans are owed, but we could address that another day too if you want. I'm happy to do that. I have done that.
I'm going to do something. I'm going to do something for the veterans, of course.
Okay, cool. But yeah, so well.
Last, I just want to get this last quote before you go on. Angie Himes, you will be surprised at how many teachers don't like our children. Can I get a witness?
Yeah, the school system is not created to benefit our children at all. It's not. And if you're a parent and you go in and you know this and you bring it to their attention, they don't like you either, because they have put my youngest daughter, on an IEP, and I told them to take her off of it. Take her off of it and stop treating her like she's different. And she's brilliant. She's an artist. She's a graphic designer, and she's a beautiful person. But because they needed the funding, they thought that they would include her in that too. And I was like, nope, you're not doing that to her. You're not. I started to do nope, and then we moved here, and she graduated with in a very good standing from their academic system. Right. So it's very true. The school system doesn't like our children, and that's why they put police officers in the schools, because they don't like our children, and they know exactly what they're doing to create the next group of slave labor.
But I'm saying
Yes.
this is going on from Seattle to Miami,
Yes, it is.
San Diego to Maine. And you mean none of us are saying, you know what? Let's do our own thing. That wouldn't that just shake up everything? Because since we are the biggest consumers, if we stop consuming everybody else's shit and start producing wouldn't that cause a wrinkle in things in our favor?
Mm-hmm. It would.
I mean, and that's what I'm saying. What's so hard about that?
Cognitive dissonance, Stockholm syndrome.
I mean, so I don't know what it is, but I'm talking about, what I see with other people like Asians, what they do, they don't come and support your businesses because they look out for themselves.
Mm-hmm.
I don't have a problem with that.
No. They travel all the way across from where they're from to come to this land that's not theirs. Let's get this through. Not theirs. Built a community in almost every state. There's a Chinatown in almost every state, and won't let you in unless you're coming to spend money or eat.
So the people who support them, who don't have nothing themselves, the people who support them, do they suffer from mental illness?
Yes, they do. There's got to be a mental illness, because whenever you're not willing to build your community but support someone else's, I would think that would be classified as mental illness.
Mental illness.
Yes, and I think that'd be a combination of all of them.
Wow. Okay. I'm sorry. Go ahead. I'm sorry. We got off track.
Okay, that's okay. So I was going through like how ADHD was developed, and it started off in the 1900s or 1902. It was mentioned by a British pediatrician. You guys can kind of go back and read over that if you want. In 1936, the U.S. Food Administration approved benzedrine as a medicine for ADHD. Basically, has been formed into being Ritalin. 1955, kept on going. 1968, they recognized it as a impulsive.
What page are we on?
We're on 43, hon.
Okay, I'm coming. Okay, here we go. Okay, go ahead.
1968, once again, the American Physician Association recognized the hyperkinetic impulse disorder for the first time, so they started calling it that. 1980.
Now what's that? Now what's hyperkinetic? What is that?
ADHD. Just another name for it. Just saying you're too hyper. You do too many things on impulse. You don't know how to sit down. You don't know how to sit still. I don't know any kids that know how to sit still. But hey, you don't know how to sit still, so now you have a disorder. 1980. I find the time of 1980 being so interesting, and the reason why I'm saying this because during 1980, what was going on in America in the Black community, or the indigenous community rather?
What was Wesley Snipes? What was the movie he played in?
New Jack City.
What's up, baby?
Pablo Escobar, the crack epidemic.
Montana.
Yep. All those babies that were born addicted to crack. Perfect timing. So let's get all these people addicted to crack, pregnant with crack, pregnant women, pregnant men. And whether you believe it or not, and I'm going to say this, when women and men do cocaine or any illicit drug or any drug period, it binds to your sperm cell as well as the ovum, whether you believe it or not. So when you, as a man, are smoking crack and you're putting cocaine and you're drinking and all that other shit, I'm going to exclude cannabis out of this because we'll go into that another day. But when you're doing all of those illicit, man-made, chemically added drugs and added to your body, and you think it's not affecting every cell in your body, it is, especially your reproductive cells. So you get someone pregnant, you're smoking crack, they're smoking crack, or they're smoking crack, you might not be, whatever. If you don't think that affected cell can cause a problem with brain development and so forth, you're crazy, because it happens. It is viable. It is true. And even though the baby might seem healthy on the inside, you need both of those healthy cells to develop a healthy child. When as a man, you're polluting yourself and you impregnate a woman, most of the time the child will develop some type of disorder in the future. Whether you believe it or not, cocaine and other drugs bind to the sperm cell, and you are just as responsible for the development of a fetus as the mother. It's not just the mother using the crack. It also comes from the father too. So you now have these crack babies. Why not give them Ritalin, another form of something that's similar to crack? Because you have a hyper kid who's all over the place, you give them that pill, now they're all lethargic and calmed down and ready to sit and listen, and they're kind of zombified. If you've ever seen a child on Ritalin, they complete characteristics change. So basically, this became more popular around the 80s up until now. And some of they have combined types of ADHD, which they say are struggling to follow instructions, appearing not to listen when spoken to, becoming confused easily, daydreaming or inability to pay attention, becoming easily distracted, having difficulty following through on tasks or assignments, losing or forgetting things or events. And then they have predominantly attentive type ADHD, which means that they have a problem paying attention to details, are easily distracted, and so forth. And then you have a combination where they're hyper and they can't pay attention as well. So I'm going to shut up in a minute, you guys, but in my opinion, now you got TV. TV moves in intervals. Like every 3 seconds, the scenes change, right? So you're constantly watching TV, and the TV is just throwing images at you, subliminal as well as in your face. So basically, you're watching TV, and that's where your attention span gets kind of fucked up at, because you're watching TV, and that's why it always, if you pay attention, count it. When you're watching a show, watch how many times the scenes change, how fast they change. It's 3 second interval. So your attention span is going all over the place. Your subconscious is picking up on that. And then you're watching SpongeBob. SpongeBob is all over the place, everywhere, bouncing all around, whatever, right? Then you go to school. What you just watched while the TV was babysitting you was bouncing all over the place, feeding that extra energy and causing those problems. You go to school, now you got all this energy because you've been sitting up on TV instead of outside playing, getting fresh air, picking flowers, chasing butterflies, which kids really don't seem to do much anymore. But you're not outside playing, you're not being active, you're not being kept busy, you're just sitting down. Your attention span is messed up because you're being programmed and taught by the action of the television. That's it. That's all you've got. So, of course, you're going to start having an ability to follow instruction. You're going to have not being able to listen because your attention span is shot. And that's why it's important that these structural learning structures are that they know about. They know that children, we don't all learn the same. They're aware of it. You learn this when you start college, which is another debt thing. But either way, these things. And so when you have these characteristics, because you're a little kid, and what are you supposed to do? And so this is what they call ADHD, and they start labeling you as that. And once again, then they put you in an IEP, and they put you in a special class, and they make it seem like you're special, when actually you're not. You're just being a child. That's it.
Well, Nicole, we're going to go ahead here. I said we're going to go ahead and close it down here.
Okay.
So, is there any last impressions you want to leave before you get out of here?
Well, I'll continue on with this because I really want to go into the learning styles to kind of bring this in with all of this. But I just wanted to come back and keep you guys refreshed on the ADHD. And if you guys have any questions or any suggestions for me, throw it in there. But once again, I think it's time that we start taking hold of our communities and our children and start saying what we will not stand for anymore collectively, because of the fact is that it's going to end up biting us in our ass if we don't. I mean, just alone with this new vaccination coming out, that who they're going to target. Now they're trying to say, oh, no, we're not going to do that. We're just going to use it in emergency, this and other, because people are starting to speak up about it. So the things that are being done to us that we're allowing, we need to stop letting that happen and start taking more control of our environment. That's all I got.
I totally agree. And I thank you for joining us this evening.
Mm-hmm.
Yes, I mean, but I think one thing we have to be real about, and we have to be cognizant about. See, when we say this mental health disorders, I hope we don't think. I hope it doesn't sound like we're taking it off of ourselves, because many of us have mental health problems.
Mm-hmm.
Many of us have mental health problems.
Yes, we do.
You go and vote for a man who is vowed to to let 11 million illegals be legal, and the prisons are being filled up with you, and that means you have a mental disorder. It's like the sister said, watching that TV, really, y'all? Really? TV haven't done shit for you since you've been watching it.
Nope.
But you get the biggest screens in the world. That's a mental disorder. How my daughter got me to stop watching football. You know what she told me? And I felt so dumb when she said it. She said,
Yeah.
I don't watch the football game with you. I said, no, why? She said, they do the same shit over and over and over again. It's boring.
Mm-hmm.
And I was like, you're right.
Mm-hmm.
You know, and she was a little 5-year-old kid telling me this. So if we don't get it, our kids come along and tell us, because they just getting here, they trying to do the right shit anyway. And you teach them the right shit as you teaching them. You teach them the right thing to do. You have them wash their hands. You have them clean up. You know, you do the parent thing. You trying to make them, more responsible and a righteous person. But when they see your actions don't mess up with what you teaching them, don't match up, they start questioning your ass.
Mm-hmm. Right.
So, we got to pay attention, y'all, because it's bad. The mental health it's not a certain group. It can be professors,
Mm-hmm.
it can be Negroes on the radio telling you to go get vaccinated. Nigga, you ain't heard of Tuskegee experiment, fool? And you're telling these people to go get, huh? But people love them type people. Oh, they're my hero.
I mean, they used the pastors of the Black churches before in the Black community. They used the pastors to get people to go get the Tuskegee protocol done to them. So imagine who they're going to use this time. I mean, think about it. And it's just like, do your research. First of all, look up Pfizer. Look at the cost of the Moderna and how it's gone up. And I mean, look at it. Look at what's going on. Don't act like you don't see it. Because if you act like you don't see what's going on, it's going to affect you. And then you're going to be screaming, I don't know what happened. And the whole entire time, you've had people like myself, like Carrie, like Chief Blue Feather, and other people telling you over and over and over again. So it's time that you guys start paying attention to what's going on in the societies as well as in your home and in the next door neighbor and down the street, because it's going to affect you, the individual, as well as your family. And they don't want our bloodlines to continue. They want them to end. So if they're willing to do whatever it is to do that, we need to be able to do whatever it is to make sure it doesn't happen.
Period. Nicole, I want to thank you for joining us tonight, love. I know you gotta make a run. So thank you again, and we'll see you guys real soon. A few days. We're not gonna go as long. With just some stuff going on. We're gonna go ahead and bring you part 4 of this presentation, because it's got some cold stuff on this mental health. And like I'm saying, it's not them people over there. It's you. It's me.
Mm-hmm.
Mental health. How do we allow ourselves to live like this? You on a planet as beautiful as Earth, you on a landmass as beautiful as America, the world comes and stomps all over your grounds, and you have no say so? For real, cuz?
It starts with accountability.
And you with it?
Yep.
And you sitting back, kicking your legs up, drinking a beer? Are you crazy? Wake up, y'all.
We got work to do. We got work to do.
So we'll see you next time. Peace.
Have a great night, you guys.